I'd like to introduce Congressman Burlison from the great state of Missouri.
Thank you, Keith. Good morning, and thank you to the Great American Health Alliance, our coalition partners, and everyone here who refuses to accept healthcare, this disastrous healthcare, as the status quo. 16 years ago, Obamacare became law, and for 16 years, Republicans in Congress have promised the American people that there is a better way. Congress has had blueprints, they've had white papers, they've had repeal votes, but unfortunately, Congress ultimately has never delivered. The families of America have waited long enough, and that's why I'm proud to stand here today for the Great American Healthcare Plan. It is our chance to stop making promises and finally give Americans a real alternative. A real market lets people see prices, compare options, and take their business elsewhere. That is not how healthcare works today, unfortunately. Since 2000, overall inflation has risen by 93%. But healthcare inflation has risen 281%. That's 3 times normal inflation, crowding out every available dollar from the Americans' pocketbooks. Only about 2% of hospital revenue comes directly from patients' dollars. The people are paying the bills, but they're barely treated like customers. Washington has gotten very good at protecting the people who profit from this maze. The lobbyists, the middlemen, the bureaucrats, they all have a seat at the table, but families paying the bills do not have a seat at the table. It may be politically easier to protect a complicated system than to take it on. But that is not why we were sent here. The Great American Healthcare Plan puts President Trump's vision into law. It gets bureaucrats and middlemen out of the way, put Americans in control of their healthcare dollars, and let the free enterprise do what it does best, which is actually work. It expands healthier spending accounts, requires plain English prices before people actually get care, uses competition to lower prescriptive drug costs, and gives families the freedom to invest in prevention and wellness. There's no honest message that's against this plan. No Republican or Democrat could go home and tell their constituents that I fought to keep prices hidden from you. I fought to keep your healthcare dollars out of your hands. That is not a message, it's an admission of guilt. But Reconciliation 3.0 gives Congress a vehicle and a chance to move this great bill forward and become law. Think about it like a football game. We have this one chance. We're in the 4th quarter, we're down by a touchdown with just 2 minutes left. For 16 years, Congress has stood on the sideline drawing up plays. Now the American people have put the ball in our hands. This is not the time for another timeout, another white paper, another excuse. We need to call the play, or we need to execute. We need to pass the Great American Healthcare Plan and go win the game. The question is no longer whether Congress has a plan. We obviously have a plan. The question is whether Congress has the spine to actually act. The clock is running out. The 2-minute warning bell has begun. Let's begin this work. And I want to thank everyone for being here, and want to introduce my good friend, someone I consider a mentor, who much of the bill, the brilliant parts of this bill, I give credit to, and that is my good friend and colleague, Chip Roy.
Thank you, brother.